This Youth Month, Healthy Living Alliance is calling on all South African young people to protect themselves from life-threatening diseases like diabetes, obesity, strokes, heart conditions, hypertension. And these have been on the increase globally. So let's talk more about this with the Healthy Living Alliance Programs Director, Nzama Mbalati. Good evening to you, Nzama, and welcome. You know, these are major public health issues which we typically associate with older people. Why is this a youth health crisis?
Well, thank you so much, Iman, for the opportunity and for having us. So we're seeing this ticking time bomb, which I would call a big crisis globally and in South Africa. We are seeing more and more young people developing health conditions such as diabetes, heart disease, stroke, cancer. Because we're seeing this emergence that is linked to, what you will call a lifestyle, but due to, the diet that we have, the unhealthy food that we have, and that actually we eat a lot of, which contains saturated fat, high in salt and high in sugar amongst the population from the first 1,000 days. And in the growing up of children and into the youth age, which is increasing the risk and susceptibility to non-communicable diseases that we are talking about.
You talk about, two of those, for example, hypertension or high blood pressure is often referred to as a silent killer because people don't get tested, they don't test their high blood their pressure often, and so they can be susceptible to things like strokes. Cancers as well, early detection, so important in order to ensure that you have a good outcome and prognosis. Is this all about information? Is it because young people aren't presented with the information that they need to make healthy food choices, or is it about other issues related to poverty and to access to good food?
So it's a combination. That's a very excellent question, man. So if you look at the food environment that we live in South Africa, from the food that children eat at home, from breakfast, into the schooling environment. So awareness is just one part in terms of behavioral change. But the biggest problem is equity. Do we have equitable access to affordable, nutritious food? Is the school environment favorable or creating a climate and environment where kids can access food? So if you look at the tech shops at school, you can control what you can pack for your children for lunchbox, but what is actually sold in school. And one of the things that we have been calling for as Healthy Living Alliance is how do we actually regulate the school food environment so that it can cater for healthier options for children. Because if you go there in the schools, children are only having access to sugary drinks, snacks, unhealthy snacks, energy drinks, in the tech shops. So it's important that we can look at this issue holistically in terms of how do we actually empower young people to make healthier food choices, but also how do we assist? So this needs an intervention of government in terms of making sure that actually the school environment and where we live, because young people are in and out of school, we can access healthier food options. So if you look at what HILA has been campaigning for, amongst other things in terms of raising awareness, is what we call the front of pack warning label, wherein we will want, food that is known to have a higher threshold of salt, sugar, and trans fat to be labeled as such in the front and to actually help raise awareness amongst young people to be able, because young people can read and write mostly, in terms of making sure that they understand what are they eating, what is in their food, and what are some of the harmful ingredients in the food we are eating.
This is such a complex conversation. I only wish that we had more time to do it, and perhaps we need to do more of them. When you think about the school eating program, it's more about the provision of school, not certain types of calories or certain types of food groups, for example, notwithstanding the fact that we've had problems just with food provision in certain provinces in the schools' nutrition schemes. The other is, even though you could have that labeling, and you talk about the front of pack warning label, which is, it's a globally accepted term about making sure that people know what's in the food that they're eating, salt and sugar content. It's a deeper conversation about, is someone even conscientized that I need to care about what I'm eating? I mean, you think of a lot of students, eating noodles because sometimes that's all you can afford. And again, not with too much nutritional value. How do we change the mindsets? In fact, it feeds into a conversation that we've just had on the program now around HIV/AIDS and about preventative behaviors. How do we get behavioral change?
Indeed, Iman. So food is a system. It's a complex issue. And if we want to actually achieve, so one of the things that we have been calling for is like resource the National Strategic Plan on Non-Communicable Diseases. Don't just have a plan. So we need education at schools. We need a curriculum at schools that can actually empower children, to understand what they are eating and what are some of the better options in terms of, eating healthier food. We need to actually look at how do we actually assist households. So we need social protection. It's a developmental issue. So it's a complex issue and it needs a multisectoral and integrated approach. That's why we're interested and keen on making sure that South Africa can implement the National Strategic Plan on NCDs. And one of the things that we have been calling for is the National Planning Commission on NCDs, so that we can have concerted effort and mobilize resources, to integrate youth, in terms of response. You spoke about HIV. It's a decades disease. Food is a lifelong, kind of struggle, and interventions that are needed in a lifelong for young people to prosper, and reach their full potential. So we do need the multisectoral approach and multiple intervention in making sure that we can turn the tide against non-health conditions and non-communicable diseases among youth.
And Nzama, thank you so much for sharing that with us. And as you say, it has to be a multi-sectoral approach if we're going to have any type of success in really arresting the problem in South Africa and ensuring that it doesn't persist. Thank you very much for sharing very, very important information with us tonight, and good luck with all your future endeavors. The Healthy Living Alliance Programs Director, Nzama Mbalati, just raising the alarm around young people and these non-communicable diseases which they are at high risk of here in South Africa.